The leader of the state's agriculture department is highlighting a silent fight in rural communities. In an op-ed this week, Texas Commissioner Sid Miller wrote about the need for more mental health resources to support the state's farming community. And joining us now to talk more about that is Commissioner Miller himself. And Commissioner, thank you so much for joining us today.
Thank you for having me.
First, in your op-ed, you talked about farmer and the ag community suffering in silence. So what are you hearing from farmers about their mental health struggles?
Well, it's been a kind of a passion of mine for a long time because the two highest rates of suicide in our nation are veterans and farmers. A lot of people didn't know about the farmers. So farmers struggle. They're pretty much independent. They don't socialize a lot. They stay out on the farm 12 to 14 hours a day. They're very proud, self-sufficient. So it's very hard for them to ask for help. So to address that, about 3 years ago, I came up with, it's not a suicide, I don't like that term. We have a national suicide hotline, 988, but if a farmer calls that, these people can't relate to their situation. They just don't understand. So we've created our own. It's called the AgriStress Helpline. So, and it's, the people on it are trained to respond to agriculture needs. They can send them to the USDA for programs, send them to my department for programs, send them to get mental health help in their local community. They don't have to go to a metropolitan area. So it's working out real good. We think we've saved somewhere between 200 and 300 farmers from taking their lives.
That's great.
So here's the good part about it. It's catching on. It's not just Texas now. We have 11 states that are participating with us.
What is that number, sir?
It's the number. You Google it. It's AgriStress Helpline, but it's 888-879-2423.
Okay.
Yeah. Took me a minute, but I got it.
Now tell us more about what you wrote in the op-ed.
Well, it's just that I think the mental aspect of rural America in general is kind of overlooked, but it's very stressful. You know, you have a farmer that's a 6, 7, 8 generation farmer, and the bank's calling his note. He's missed 3 crops. He's responsible for the family heritage. There comes a point where, you know, in that situation, you no longer own the land. The land owns you. You're part of it. And now you're responsible for losing the family legacy. So it's a tremendous amount of strain on a farmer that gets in that. And most of them, like I said, they don't socialize. They're too proud to ask for help. So that's what this program is. Well,
in your op-ed piece, you wrote, the very traits that make our ag community great, independence, resilience, toughness, all the things that you mentioned, are the same qualities that sometimes prevent farmers and ranchers from seeking help when they need it the most. And that's not just a problem for them, it's a problem for us too. So why do you think it is so hard for those in the ag community to ask for help? And how does this affect everyone, all Texans?
Well, and you kind of explained it. I mean, they're very self-sufficient, they're self-reliant, they don't take charity, you know, they're very strong, independent people, and it's very hard to reach them. Now we've kind of changed our tactics. We found a chink in their armor. So instead of appealing directly to the farmer, you know, to a man that's 70 years old to go get mental help, we found that it's more receptive if we get a grandchild or a child to ask that person, you know, Papa, let's go, would you do this for me?
Because Papa would do it for their grandchild. No, that's absolutely right.
There you go.
And so what has the Ag Department done to support people who need mental health in rural communities?
Well, people don't know this, but I have a pretty large agency. So within my agency is a sub-agency called the Office of Rural Health. So we're responsible for delivering rural health care in 191 counties across the state. And part of that is mental health. I mean, it's just as important. So that's how we're involved, and we're leading the charge of delivering mental health care across rural parts of our state.
No, that's great. And so what more can be done, or what can the legislature do to help?
Well, I asked the legislature to fund this program, which they have, and they gladly refunding it this time. They see the value of saving the lives of these farmers, so we have no pushback on that.
How much money does it cost to run this program?
You know, it's not very expensive. It's about $500,000 a year. You know, but to save lives, we think it's worth it.
Oh, absolutely, every penny. And does that go toward paying salaries and?
We have to pay the people that man the center. Absolutely. So we man it 24 hours a day, 7 days a week, 365 days a year. We speak over 30 languages. So, I mean, they have over 300 hours of education to be able to respond to these farmers. So it's very intense. It's not a fly-by-night operation. It's a very professional organization.